Good morning, Malcolm.
Good morning.
And thank you so much for taking the time out of what we know is a very, very busy schedule to speak to our members through the Alliance Live mechanism. Thank you.
It's my pleasure.
Thanks. So we're going to take a little bit of time this morning. I'm going to ask you a few questions in areas that we think that our membership will be particularly interested in. And it's from your point of view, in your position. So here we are in January 2020 and thinking about the 2020 vision, which was launched back in the day. Where do you see have been the major advances that we've made towards the ambition of people living longer, healthier lives at home or in a homely setting? Where are we now?
Well, I think we've made a lot of progress in recent years, and I've worked in and around health and social care for many years and just kind of seen the progress. So I think the shift towards prevention has been really, really important. I think early intervention, so I think it's much more widely accepted that we should keep people out of hospital if at all possible. If folks do have to go into hospital, it should be for as short a time as possible, and that we should get people discharged from hospital as quickly as we can, but discharged into homely or home-like settings with care provided for those people within those community settings. So I think that kind of shift, I think that sort of focus on the right people, the right place for people is at home or in a home-like setting. And I've also seen a lot of progress with how the whole system is starting to work together much more effectively, and I'm sure we'll come on to health and social care integration in a minute. Mm-hmm. But I think those have been some of the things that have really come forward for me. I'm also really encouraged by having worked in health boards and now working in Scottish Government, just to see how much more partners are becoming involved in, designing the care systems locally. So I think the role of the third sector, I think the Alliance has been hugely helpful in that regard in terms of pulling a lot of those contributions together, making the case at a national level, but also being able to help local partners and really making sure that the third and the voluntary sector are kind of fully engaged in the design of those services. Because I do think that balance between what we can do on the statutory services, what can be done by communities and third sector services, and really building on and relying and understanding the assets within a community, I think we're in a much better place than we were several years ago.
Are there any particular challenges, do you think, that we have faced in these years between the launch of the vision and where we stand now in early 2020?
Well, I think lots and lots of challenges. I mean, I think the demand for care, I think the needs of our population have changed and are continuing to change. And some of that manifests itself through increased attendances at accident and emergency departments, at increased calls to NHS 24, the work of the ambulance service, people wanting to come and see their general practitioner. And I think that a lot of that is a function of the demographics of the population. Now, I think we recognised that some time ago, and I think these policies that are really designed to care for people in communities as far as we possibly can. But I think those changes are happening, and I think those changes are continuing to happen. So that, to me, is one of the reasons that we need to continue the programme of reform, but at pace and scale.
Turning now towards health and social care integration that you've mentioned, how far do you think we've come in achieving the ambitions contained within that integration approach?
Well, I think in recent years we've actually made huge strides. And I think in every single integration authority across Scotland we can demonstrate that there has been real and tangible progress. And I think the establishment of the integration authorities, there have been various challenges and all of that, making sure we get the partnership working between the integration authorities, the local authority, the health board, the third sector organisations. There's a lot of work gone into making sure that is set up. But I do think that in every single integration authority across Scotland we can demonstrate, and they can demonstrate much more importantly, that there are a range of things that have happened that wouldn't have happened otherwise, and I think that's really, really good. I think the challenge is that there's a lot of variation, and from this position, I can see into some of the work that's going on into all of the integration authorities across Scotland. Some of them are doing some things really well. Some integration authorities are struggling with challenges, and I think part of the challenge for all of us is how do we make sure that we bring everybody up to the standard of the best, and that we proceed and reduce variation. And if something can be done really well in one part of Scotland, why can't it be done in another part of Scotland? So we do need to be respectful of local communities and local systems. And when we see something that can work in one part of Scotland, the challenge is why can't we get that working everywhere? So I think from a government perspective, we're really looking to work with, support, challenge integration authorities, local authorities and health boards to work together to make sure that the pace and scale of reform is really increased.
And do you think we have the mechanisms for that joining up and sharing of good practice?
Well, one of the things that has been published quite recently is the framework for health and social care, and that contains within it a number of things that we know that work. So the work that's been done on what's the evidence, what do we know works, and if it does work, let's just make it happen, and move away from a sense if it wasn't invented here, then we're all very different, and of course we are all very different, but actually we're here to serve the needs of the population of Scotland, and as I say, there's some great examples of that around Scotland.
It's interesting that you mentioned the integration framework. The Alliance are hosting in early February a session with David Rowlands and others to come together to talk about the role of third sector within that. So from your perspective, how do you envisage the third sector really realising that equal partnership role that we often talk about?
Yes, and I think it is important to recognise the vital importance of the third sector in Scotland, and having worked in various health boards across Scotland and having worked closely with third sector organisations, the range and the depth of the expertise that is within those organisations is huge. And I think one of the challenges we ask our health boards and our integration authorities is around how they're best engaging that, how they're mobilising that. And I know that organisations like the Alliance, like the Red Cross, been hugely helpful in terms of getting community links workers up and running, for example. So that initiative that seeks to join up what we're doing in primary care settings, I'll maybe talk a little bit more about that in a minute, with that set of community assets that we've got, and really signposting people and helping people to services and support that they can get, that means that they don't need to go into hospital. I think that's all good. So we just need to keep reinforcing that and making sure that the third sector is fully engaged in that.
Is there anything around leadership within that mix? So often we talk about numbers of staff, and the new workforce plan that was launched in December very much focuses on succession planning and configuration. Is there something about the competencies around leadership that we could perhaps look at in supporting that third sector engagement with the integration authorities and with the health boards?
I think there is, and the integration leadership group that I chair alongside Sally Loudon from COSLA, that's been hugely helpful in just bringing together Scottish Government, the service, local government, and that's one of the things we've been talking about how we make sure that if you're leading an integration authority, if you're leading a health board, if you're leading a local authority, part of the job is to do the job and run the organisation, but a big part of the job is to look much more broadly right the way across the system. And I think we're all convinced that the quality of the working relationships, particularly between the integration chief officer and the two chief executives, is vitally important. And then how they're creating the kind of environment that is actually fully involving the third sector and all of the community assets, and taking a much more holistic view of the communities that they serve and how best to join up and design services. And that's not something that can be done from central government, that's something that really has to be done locally, and our job is to encourage that. So when you ask about leadership competencies, I think we're really trying to make it clear about the kind of leaders that we want to see, that aren't just competent in running the organisations and the governance and the money and the staffing and the outcomes and all of that. That's kind of base camp. I think there's a step above that that says, well, how well can you work with your statutory partners and your third sector partners? How well can you engage with communities? And I guess the thing I've come to learn over the years is that if we ask people what matters to you, if we ask communities what matters to them, we'll come up with a set of solutions that we wouldn't have seen otherwise. So I think it's very much encouraging that sort of approach.
That leads us nicely into my next question, which is around the commitment to prevention, supported self-management, and the provision of treatment and care services in the community.
Yes.
What are we doing, and do you think we're doing enough to bring the public, people who use services and staff, into that conversation about the challenges and opportunities of different models of care and support and what that might mean?
And I'm sure that we need to do more about that. One of the things I've been hugely encouraged by is how the concept of realistic medicine has really taken off, and I think Catherine Calderwood, our Chief Medical Officer, has very much been leading on that. And a lot of that is about how we change the dialogue between professional people who have been trained and who've got a huge amount of knowledge, and the person who have got a huge amount of knowledge about their own lives and their own circumstances, more towards a conversation about what matters to you. And sometimes just because it can be done doesn't mean that it needs to be done. So I think having that conversation and having an understanding of the person, the social circumstances, the community circumstances, and what's going to work out best for them, and really helping professional staff to have those conversations and to come up with a set of solutions that are really going to work much better for individuals. That's part of changing that dynamic. And I've witnessed over a number of years really quite a shift when I've been working with healthcare professionals about just how clear they are about having conversations with people, understanding where they're coming from, and really trying to do the best for them, and making sure that if something's happening in hospital, then they can connect with services within the community, and they're part of a much wider system.
So looking ahead now beyond the 2020 vision and to what a future horizon might look like, Don Berwick might talk of a third era, International Futures Forum we talk about a third horizon. So we're pointing forwards. How do you see that vision emerging now as we are going forward in 2020 and for the 21st century?
Well, I think it is emerging now, and I guess I would point to the public health reforms that we've got up and running, and the public health priorities that we've got, and our real focus on reducing inequalities, reducing health inequalities. So the establishment of the new public health body, which uniquely is a partnership between Scottish Government and COSLA. I think that's a really important, not only a signal to send, but it's a really important practical thing that we're doing to say we're casting the public health net much more widely in and around communities. So Public Health Scotland, I think, is a huge opportunity. I think the primary care reforms that we're taking forward, and very much looking to make the GP the expert medical generalist, and making sure that we can bring GP practices together in clusters, and we build multi-professional teams. So the appointment of community pharmacists into that, into advanced nurse practitioners, the community links workers, and really building up that infrastructure and resilience within communities. I think those things are really important. So there's a lot of reform that's already happened. I think we know what works. We've got lots of examples of what works. I think it is about increasing pace and scale. And I think as we drive forward with our public health reforms, our primary care reforms, you mentioned a minute ago the integrated workforce plan. That's a first within the UK, where we're trying to really cast what does the workforce need to look like in the future, and making sure we've got the right people with the right skills and the right places to deliver that for people. So I think the course we're on is the right one. I suppose the other thing I would mention would be the social care reforms that we're embarked on. and how we can make sure that that social care that is provided in people's homes and in institutional settings, what we need to do to increase the resilience of all of that. And that's a thing that we're looking to co-design with communities and with people. So I think we're on a journey. I think we've come a long way. We've got a long way to go, but there's a real determination that we're going to drive this forward at pace and scale.
So you're painting quite a complex picture there of interconnected, forward-facing initiatives. Just a few questions just to pick up on that. Public health reform, absolutely, the new Public Health Scotland body being launched this year. Do you think there are opportunities within that for the public, the population in Scotland, to become more fully engaged in some of the major public health challenges we're facing?
Of course. And I think one of the big challenges and opportunities for Public Health Scotland is to mobilise the public health workforce and to see how we can get that conversation and dialogue with communities about what matters to them and what we need to do within communities. And of course, a lot of improvement in public health and population health is outside the purview of the National Health Service. So what we're doing about housing, what we're doing about the built environment, what we're doing about the green environment, how we make sure that there's a vibrant economy and there are jobs, what we're doing about climate change, all of those things in terms of people living in situations where they have control over their own lives and there's a range of assets around them and they can be supported in that. So a lot of the gains that I think we're going to make in the future in terms of public health lie in those areas. So that conversation with the public and through local bodies, I think is going to be very important indeed.
I mean, obviously from the Alliance perspective, a major part of our rationale and our engagement with our membership is bringing that voice of lived experience to the table, not only in a consultation phase afterwards, but actually co-creating and co-designing the work and the change that needs to happen. So my question is, are we doing enough, do you think, to support staff to reframe practice, clinical practice and social care practice, so that we can more fully live that empowerment agenda, the supported self-management, the person-centred approach? Do you see that we're making inroads in that in relation to the workforce?
I'm certain we are making inroads, and my conversations with healthcare professionals around the country, I think that that has shifted quite considerably in my view in the last few years. I would want to pay tribute to the work that the Alliance has done, not only championing these issues at a national level, but very practically, locally, working with individual partners to help kind of recast and redesign services and really helping the, as you say, the voice of lived experience to come through. And I think the more we can listen to people, the more we can listen to the needs of a community, the better the services that we will get at the end of the day.
Resources are always a challenge, and from the third sector perspective, one of the barriers that we would describe would be that when money gets tight and resources get tight, what we hear is that often third sector services are facing cuts and closure, not because they're not showing impact and effectiveness, but simply boards and IGBs are struggling, and we can see that. But I'd point to a recent roundtable, and you mentioned the Red Cross, and the Alliance hosted a session in November this year with government colleagues and Red Cross, looking at how can what is third sector currently doing to support people to be at home, to reduce hospital times when people do still have to go in. And we're planning a session for March, and we'd love to have further input in this discussion, because the third sector does provide an important resource in that collective picture. The workforce plan identifies that the third sector is an important part of the workforce, and one of the key commitments in the integrated workforce plan is that the third sector will be seen. Do you think there'll be resources that will help to strengthen that in the longer term?
Yes, and there are a number of different kinds of resources, and as you rightly say, finances are extremely challenging in different parts of the country. I also think that some of the most valuable resources that we've got are people, and I think laying out a plan that helps us to get trained people in the right place making sure we're not relying so much on, say, locums and temporary staff, that we're getting permanent staff in place, that they're properly trained, but we're doing it in the context of the whole system. And I think there's a lot of actions at national level that we'll take in following up that integrated workforce plan, but there's an awful lot that we need local partners to be working on together to say, well, what are the workforce needs that we are going to have in the future? How can we make sure that we get a supply of people through? And that can be through the statutory sector and the third sector as well. And I would very much want to encourage the third sector to play a full part in that, and we're very much encouraging the statutory sector to say, look, we need to make sure the third sector is part of that.
Excellent. So thinking about your position as Chief Executive of the NHS in Scotland and Director General of Health and Social Care, in what is an area of complexity, it's systems and processes, and there's a rich tapestry there that you're sitting within. We talked a little bit earlier about the leadership competencies, and we often talk about compassionate workplaces, compassionate leadership, compassionate organisations. How do you see us strengthening the thread of compassion through our organisations for the people we serve, but also for the staff that are in those services?
Yes, and if we look at the National Performance Framework, for example, that uses the word kindness as well. So it's how we train up and develop our staff to deliver their services in a person-centred, compassionate manner. Now, rather than looking at it, from government kind of top down all the way through, I think if we look at things increasingly through the lens of the individual's needs, the lens of community needs, we'll see things in really a very different way indeed. And actually, the more conversation we have, the more compassion that we show, the more understanding that we show of individuals' needs, actually we'll get much better outcomes. And I think the overwhelming majority of healthcare professionals and social care professionals, see that and understand it. And our job is to create the climate and culture in which they can do that work, and to create the expectation that that's the way that we require services to be delivered in the future. We've had the Sturrock report, for example, and that gave us quite a bit of cause for thought, but a huge amount of opportunity really to define how we want to see the culture of health and social care within Scotland. So I think staff working together, supporting each other, having psychological safety and being able to get on and do their work, working in multi-professional teams, and actually to set the expectation that we expect staff to work together in partnership, across professional and organisation boundaries, showing compassion to people and to listening to people. And I think it's just setting those expectations from national level, and I think that's part of my role really.
I'm so pleased to hear you mention psychological safety. I'm a huge fan of Brené Brown's work, and I was on the webinar with Brené that Healthcare Improvement Scotland organised, but I guess my call would be, let's include people in that compact of psychological safety as well. So that I think that would be one thing that we could do to accelerate change is that common humanity. People using services, seeing care providers as human beings and vice versa. And I think given the resources that we have, even if there's nothing additional, we could do much more with what we have if we see each other as human beings.
Yes, and I think, as I say, seeing this through the lens of individuals and their own lived experience, I mean, it's a huge responsibility that we collectively have, and we look after people at times in the most vulnerable and difficult and challenging situations, where, be it physical health, be it emotional health, be it social structures around people, and just trying to put yourself in the other person's shoes and how they're coping, how they're managing all of that, and to really listen to people. And it's a huge responsibility. It's a massive privilege to do the kinds of jobs we all do. But it's also a huge responsibility to make sure that we get things as right as we can. And no one of us can fix things on our own, but if we can design networks of care with people working together as part of multi-professional teams, looking after people, making sure people get the best outcomes that they possibly can, and that their life journeys can, go through to a good end. And one of the things we've seen, I think, is that more elderly people are spending more time at home rather than in hospital. I think that's good, but we just need to provide that caring environment for people in their homes and home-like settings.
So here we are, early January. Many people make New Year's resolutions at this time. Have you made a New Year's resolution, if I might ask?
I've made lots of New Year's
Would you like to share one with us?
Resolutions.
But what keeps you healthy and well in this position and this role that you're playing?
Well, I'm hugely enthused and committed to what I'm doing. And I've had a career in the health service for more years than I'd care to admit to here. And I've had the privilege of working in a number of different parts of Scotland. And I've seen up front, the most amazing examples of, professional, care being given to people. And I've seen, and I've witnessed the coming together of systems in a way that I've never seen before. And as I said before, we've got loads of examples across Scotland of this happening. And I think if folks wanted a really good contemporary example of that, I think the Health and Sport Committee before Christmas took evidence from a range of colleagues in the northeast of Scotland. Now, if you read the transcript of that, and if you get behind the dialogue that was going on there, I think what we witnessed there was a series of colleagues who were, deeply committed to working with each other to get the best outcomes for individuals. And I know that that is replicated across Scotland. So if you're asking my New Year's resolution, or one of them, is to really increase the pace and scale of that change, and to make sure that, where we have things going really well, we can reduce variation across Scotland, and we can increase the pace and increase the consistency of those reforms. Because I think the packages of reforms that we've got, I think, are pretty comprehensive, and I think it's how we deliver those reforms at pace and scale. And I think my role in terms of working with integration authorities, with health boards, with local authority colleagues, and really helping to drive that pace of change is where I want to be.
Thank you. Is there anything else I've not given you a chance to say this morning, or something that I wouldn't want to leave you with anything unsaid, if there was anything you wanted to add?
Yeah, I think one of the great strengths we've got in Scotland is the relationship between Scottish Government ministers and COSLA, and really setting this in a joint, national government, local government, and we see that partnership played out very strongly between Cabinet Secretary and Councillor Stuart Curry. My working with Sally Loudon, Chief Executive COSLA, I think that, and I guess what we want to do is to set the example of the kind of working that we wish to see locally, and I think how we hold each other to account for all of this, and how we work with the Health Chief Exec, the Local Authority Chief Exec, the Integration Chief Officer, and kind of sharpening that up a bit, and having those kind of dialogues about, are we achieving the outcomes that we said we were going to achieve? How do we measure some of those things? What are the barriers to change? And how can we at a national level help local systems to really get on and improve? And if there are barriers, how can we work through those barriers really to get those changes for people? Because I think if we keep focusing on the individual citizen, the individual community, and keep that as our major point of focus, and then work back from that, what we can't have really is barriers and blockages between organisations that are getting in the way of that stuff happening. So how we, just make sure those lines of accountability are working crisply. And I think there's things in there too about our scrutiny environment, and whether or not we can, to be doing more to streamline some of that work. And then I think finally just how we support individuals, with leadership, both in terms of support, but also in terms of challenge for what they're doing. I think there's work that we need to be doing more in that area as well.
Thank you for sharing that with us. I think that's a narrative that our members and the wider public will be encouraged to hear as we're looking forward from 2020. Thank you, Malcolm.
My pleasure. Thank you very much.
Thank you.